The COVID-19 epidemic has swept the world. Taiwan's Ministry of Health and Welfare, MOHW, immediately launched prevention and control measures. MOHW adheres to the vision of becoming the most trustworthy ministry, as well as a major policy of holistic throughout Wellbeing Guarded and Wellbeing Upgraded international synchronization, and actively implements the mission of promoting health and well-being for all. Taiwan's birth rate has continued to decline, and its population has undergone negative growth for the first time. MOHW continues to create a child-friendly environment, provides quality care for pregnant women, infants, and children, builds a children's healthcare network, and enhances the protection of the rights and interests of preemies and rare disease children. Taiwan promotes the publicized and quasi-public child care policy, deploys public child care resources, and improves the child care system to demonstrate the government's support for families. Alternatively, Taiwan's proportion of people over 65 years of age increased to 16.1% in 2020 and has gradually become a super-aged society. MOHW continues to improve care for the age-friendly and dementia-friendly environment. We set up health promotion courses for the elderly and subsidize the promotion of age-friendly dietary services. It pioneers a pilot program for elderly care to delay the onset of disability, the upgraded Long-Term Care Plan 2.0, and 5 additional measures, including long-term care funding, family care, service items, daycare centers, and affordable residential institutions. In 2020, the overall satisfaction rate for Taiwan's long-term care reached 92%. At the end of 2019, MOHW became aware of the emerging COVID-19 pandemic and immediately developed a countermeasure. Taiwan Central Epidemic Command Center, CECC, was established on January 20, 2020, and then upgraded its COVID-19 task force to Level 1 on February 27th to fully integrate government resources. Additionally, the Special Act for Prevention, Relief, and Revitalization Measures for Severe Pneumonia with Novel Pathogens was promulgated on February 25th. In response to the COVID-19 pandemic, Taiwan continues to strengthen border controls and quarantine measures using big data and smart technology systems. The central administration cooperates with local governments to connect anti-epidemic resources. Taiwan establishes a precision screening and epidemic prevention model to accelerate the development and acquisition of vaccines, drugs, and test kits to publicize information transparently. Additionally, Taiwan advocates the new lifestyle for epidemic prevention to enhance the awareness of epidemic prevention in multiple fields and encourages people to incorporate anti-epidemic measures as part of their daily routine. Although Taiwan was not invited to participate in the World Health Assembly in 2020, we still had actively shared our anti-epidemic experience with the world and simultaneously donated epidemic prevention supplies to the United States, the European Union, Japan, and other countries, demonstrating the spirit of Taiwan can help, Taiwan is helping. Over 1,700 legislators in more than 80 countries have publicly expressed their support for Taiwan. The U.S. Secretary of Health and Human Services Alex Azar also visited Taiwan to strengthen bilateral health exchanges between the two nations. Secretary Azar represented the highest-level cabinet official to visit Taiwan since the cessation of diplomatic relations between Taiwan and the United States. Moreover, MOHW presented Taiwan's digital technology and epidemic prevention know-how, introduced its crucial policies for combating COVID-19, and shared Taiwan's other epidemic prevention experience at the APEC high-level meeting on health and the economy to encourage global cooperation against this scourge. Taiwan continues to strengthen the social safety net by improving its social workers' working conditions and salaries. Incidentally, social workers in the private sector also receive MOHW's subsidization for salary adjustment. In June 2020, Taiwan's president introduced the Public Health Specialists Act to buttress a professional public health system. To increase service accessibility, MOHW has expanded the capacity of the 1922 hotline and launched a phone diversion center. The 1957 Social Welfare Consultation Hotline has greatly enhanced the capability of emergency relief consultation, strengthened the integration of police, social work, labor management, education, and public safety net. Diversified local services include social welfare, a one-stop shop, domestic violence support, a one-stop center, and Smart Health Cloud, a one-stop service. The IDS programs provide healthcare to remote regions, which enables residents in underserved areas to access healthcare from academic medical centers. Overall, MOHW desires to create a more agile healthcare system that quickly responds to people's needs and brings needed services closer to users. As the pandemic continues to morph, social distancing still needs to be maintained. We will continue to listen to the public and provide excellent services to create a new situation for the promotion of national health and welfare.